Modern medicine has meant that ailments such as cancer and dementia are no longer the fast death sentences they once were. People can now live for many weeks, months, and even years with conditions that would once have been fatal in a heartbeat. However, just because a patient is alive does not guarantee a quality of life, begging questions as to whether, in the pursuit of beating the disease and beating death, we have lost sight of what the needs and wants of elderly patients and those with terminal illnesses may be. In this video, we will be exploring these issues in context of a doctor's responsibility and ultimately arguing that giving autonomy of their final moments to the patient is the only way which the clinical duty of care can be met. A doctor's responsibility of care and looking out for the best interests of their patients is often summarized in the phrase, "First, do no harm." And at first glance, this would seem to come into direct conflict with the core principles of euthanasia, as what could do a patient more harm than ending their life? However, if we take an example of a patient diagnosed with a terminal illness, it might just be that their last few months of living are filled with pain and ruled by medical treatments. In this case, which really does the patient more harm? To prolong their life until even the drugs and our machines can no longer keep them alive? Or to give them a peaceful death, where this sort of suffering is never faced by the patient and never witnessed by the family? It is not by any means an easy decision and should therefore not be entirely put in the hands of doctors, but instead perhaps ask straight to the patients, asking them around the time of diagnosis the extent to which they would like to suffer at the hands of their illness, or at the age of 65, according to Age UK, the disability-free life expectancy of the UK, and asking them the point to which they wish to decline at the hands of dementia and old age. This, while it might seem macabre and direct, would serve to normalise death as a natural part of life which can be met with dignity, and serve to give back a sense of control and autonomy to patients at a time where all feels quite overwhelming and where it is easy to feel powerless in comparison to the disease and one's own body. In this way, it might just be a clinical responsibility to ensure that we do no harm and do not prolong life and suffering unnecessarily by allowing people to choose their own end-of-life preferences.